Hello, I'm Dr. Paul Homoly. I'm here today to make it easy for your patients to say yes. I practiced implant and restorative dentistry for 20 years. And since I left practice, I've been literally around the world, around the country, seeing what the best practitioners do to have their patients say yes. Today in this short video, I want to give you a tip. One of the things that I know that will help you and your team and also help your patients get the health care they deserve. See, one of the problems that we have, especially as implant dentists, especially as dentists who do full mouth reconstructions, we're quick to make a diagnosis. We're almost too quick to offer a patient a solution. I would bet that 9 out of 10 doctors, when they hear from a patient who's got maybe some rotations in the anterior teeth, they automatically start thinking about how to fix the teeth. What I'm saying to you is, don't do that. Stop it. Instead, take the time to find out why this patient feels the way they do about her condition. A great way of doing that is by asking an open-ended question like, well, can you tell me about a time when this bothers you the most? Another good question would be, well, can you tell me about a time when you first noticed this problem? The secret here is in the phrase, tell me about a time. You see, you want to get the patient into a storytelling mode. You want them to talk about their environment, either at work or at home, or where this condition finds itself, where this condition gives them a problem. Once you understand what the patient's chief disability is, then you automatically understand the chief benefit. See, the chief benefit is always the emotional opposite of the disability. If the disability is shame, then the behavioral benefit would be dignity. If the disability is fear of losing their teeth, then the benefit would be safety and confidence in keeping their teeth. You see, it's understanding the disability that automatically leads us to the chief behavioral benefit. And it's the benefit that brings patients in. Now, let me be quick to say, is that clinicians oftentimes confuse clinical benefit with behavioral benefit. See, the clinical benefit is the opposite of the condition. If the condition is periodontal disease, then the clinical benefit would be reduction of oral flora or reduction of pocket depth or reduction of mobility. Whereas the behavioral benefit might be more confidence speaking in close situations or more confidence in keeping their teeth. You see, there's a big difference between clinical benefit, which is what we talk about as dentists, and behavioral benefit. That's what patients talk about. And finally, the last piece I want to discuss is the concept called the chief fit issue. This is the big one. A fit issue is a life circumstance. A fit issue is a budget or work or health or aging parents or all the different interstices that patients have in their life, all the complexity. And it's the fit issues that give patients the opportunity to say yes to care if it fits into their life. Let's do a case study. 3 patients. We've got John, Sally, and Kevin. Now, these 3 patients all have identical conditions. They wear a mandibular partial denture replacing all their posterior teeth. The partial denture was made about 15, 18 years ago. Had plastic posterior teeth. Those teeth have worn down over time, allowing the maxillary posterior segments to super erupt. That created a 2-step smile line, and the first point of occlusal contact was on the anterior teeth, which pushed the upper anterior teeth out, creating mobility and diastemas between the anterior teeth. You see it all the time, don't you? This condition is very common. Well, these 3 patients have identical clinical condition, right down to the probing of the periodontal pockets, identical condition. Now, let's look at John. John's retired. He has plenty of money. His avocation is he's a yacht captain. He pilots yachts all over the Caribbean between sailors, between buyers and sellers. And he's got, boy, he spends so much time at sea, and he's single, and he's thinking to himself, boy, I'd love to have some companionship on board the yacht. And one day his daughter comes up to him and says, Daddy, you'd have better luck with the ladies if your teeth didn't make you look so old. Well, he looks in the mirror, and all of a sudden he goes, you know, she's right. So all of a sudden now John's got a disability relative to his teeth. He wants to look sexy. He wants to have a relationship. Time isn't a problem, rather money's not a problem for him. Time is a major fit issue for John because he spends so much time at sea. Let's look at Sally. Sally was married to Guy. They were married for 44 years. One day Guy passed and Sally didn't know what to do. I mean, Guy worked, he took care of the car, the houses, Sally raised the kids, she did a great job with that. And after Guy was gone, Sally was lost. She wasn't even sure where the insurance was kept. She didn't even know who their attorney was. She was driving down the street and the check engine light came on and she pulled off the road. Sally was afraid of everything. One day she had lunch with her friend Dorothy. And she's eating lunch with Dorothy and she noticed something different about Dorothy, something she hadn't noticed before, and she wasn't quite sure what it was. Well, in the conversation, Dorothy mentioned that she had dentures made about 4 or 5 months ago. And Sally looked at her and thought, wow, I don't want that. Dorothy looked so old. That evening, Sally goes home and she walks up to the mirror and she grabs her front tooth and it moves. She had this huge sense of fear. Let's look at Kevin. Kevin is a fire chief in a small town, wants to be a fire chief in a big town. And as fire chief, often they find themselves in the media. Big building or a big catastrophe, the fire chief is on TV. And he noticed that he didn't like the way he sounded. He was slurring his words and it just didn't seem right. Not the type of appearance he'd expect to have, that he wanted to have to be a fire chief in a big town. He wanted prestige, he wanted confidence. Now, we have 3 patients with all identical clinical conditions. Now, if you were to have a process-centered conversation with these 3 patients, your conversation with these patients would be identical, wouldn't it? Come on, it's the same condition for every patient. You would talk about plane of occlusion and maybe some movement of the teeth and implants to support the posterior segments and on and on and on. You know what you do here, but the conversation would be very similar. However, you would completely miss the mark in terms of the benefit that they're really looking for. Each one of these patients has distinctly different disability, consequently completely different behavioral benefit. And your treatment plans based on process and condition are far less influencing to these patients than conversations based on disability and benefit. If you find yourself saying the same thing day in and day out to patients, chances are you're talking about process-centered conversations. And what I would suggest to you, if you want to make it easy for patients to say yes, then learn to talk in terms of chief behavioral benefit. Learn to talk about the fit issues in their life. Combine those issues that are going on in their life to what is going on in their mouth. And you'll find that when you're able to do that, it'll be a lot easier for patients to say yes. So my gift to you today is the 4 chiefs. Chief condition, that biological entity that's outside of normal limits. The chief disability, it's how they feel about that. The disability is never in their mouth, it's in their life, it's in their soul. The benefit is the opposite of the disability. This is the biggest motivating factor in the patient's life. And of course, finally, the chief fit issue. It's those conditions, it's those issues that are going on in their life that we need to fit our dentistry into. And when you can do that, you're going to make it easy for your patients to say yes. I'm Dr. Paul Homoly, and thanks for listening.
For more education programs, visit the GIDE Institute at www.guidedental.com.